Olympic Committee, I was a member of our team in Paris now, and so I was talking about with Patrick about maybe the future of this project for the persons and for the athletes with disabilities, that we can talk about it later. So if you don't record it, don't publish it, don't film it, it's not going to happen. So this is why it's important for this. I will show you a brief statistic analysis of a report for this part. And after I finish, I will show you what we published recently from Croatian data from previous ones. So just to see, and you can download it if you need some data to reference yourself in the future work. So this is only abbreviation, just to see, not to comment, but all partners are here. I just want to show this. Maybe first data is descriptive statistics, and what are differences in population and age groups, how these chronic diseases, current medication is used, disturbed sleep, high blood pressure, diabetes. We have different distributions, but major thing is that when we put in statistic tests, they are not completely different between partners. Okay, that was one decision. When we want to present everything, we put all of our participants together. And when we see measurements by baseline and after 25 weeks of therapy, this is only this part of regarding socio-demographic clinical parameters, hobbies, chronic disease, current medication use, disturbed sleep, high blood pressure, diabetes. There are no significant differences. This one p-value here is it. If it is below 5%, it is significant. But as you can see, everything is good because we can say that these parameters are not changed during this follow-up process. It's not supposed to change because we have chronic disease. It's not going to cure itself. But what we try to see, there are several different categories. First, we wanted to see if we have possibility that we successfully managed to get our participants to have more active during this period. We did. So we can manage it. We have significant increase or high physical activity in the other person. This is one key factor. Are crucial for WHO, World Health Organization, has serious recommendation of physical activity for elderly persons. One of the recommendations that they have at least 150 minutes per week of somehow. But if you can manage for them to get a little bit higher, to get aerobic exercise, to get your pulse a little up, you have better heart conditions, better aerobic effect in your health, and that is important. We divided this IPAC, this is International Physical Activity Question for Elderly, in several categories. When you divided this first one, I want to show this. This one is the total score. When we divided in minutes per week of vigorous activity, moderate walk, total sitting during the day. In these two parts, we are borderline significance, near 5%. That's maybe because we have, if we had maybe 20 more patients included, maybe this will be significant. But this is only one key point for the future projects. We still have elevation in total metabolic equivalence and MEC minutes per week, and if we can see from these minimum maximum values that we also had lowered sitting during the day. That is also different. And now the second part of our topic in the project is quality of life. This is standardized, translated WHO quality of life short questionnaire. Everyone who participated knows that questionnaire. As you can see, we have several domains: physical, psychological, social, environmental, and total. Here, and here we have significant elevation of quality of life. Only social domain stays the same. It's like 66 and 66 because participants proposally who come to your trainings are have social life, social quality very good when they already come. So you do not have any room to improvement. But as you can see, elevation in physical domain, in psychological domain, in environmental domain, and in total, we have all significant values. I can say this red line, it is like a recommended value of quality of life. And this is a box and whisker plot. This is median value. This is 25th quartile, and this is 75th percentile. This is minimum and maximum. This is outliers, you can come down. But as you can see, a majority of your participants already had good physical domains. So very interesting. Maybe in the future projects, maybe you can catch those who have maybe in this area. Usually the persons that can go on this kind of exercises have in the beginning good physical health. But now, no matter that, we have elevation in physical domain, we have elevation in psychological domain. We have the same in social domain, as I already said, but as you can see, we have also a population that also improved somehow their social domain, but not significantly. And we have elevation in environmental domain. So this is total score. So conclusion, I already said that we successfully showed that we have significant increase in their high level of physical activity. And in all the 4 or 5 domains, 4 of them were also increased. And for the end, just to show you. Oh, sorry, just to. Why? Just to see, because we don't. I have PDF here. It's not shown on the screen, but maybe there is print screen. I will put the presentation. My excuse, I did not. That doesn't matter. I want to show you for the finish that we published one very big work named Effects of Tai Chi Exercise on Pain, Functional Status, Quality of Life in Patient Osteoarthritis and Inflammatory Arthritis. This year for several months. Croatian team, and this is maybe one of the several references that you can put it in your future projects. It's very big issue, how to say it, because you know better what we have done to publish it. It's not easy task, especially when you have like traditional medicine reviewers that want to review something that is maybe for them alternative medicine. And I want to thank you for all the opportunity to be here and opportunity to maybe collaborate together in future research. Thank you.
everyone. This second part that I wanted to show you was a publication in Turkish scientific research magazine, and it was for our first project, where the results were also really significant. For our second presentation, I would like to invite Mrs. Gordana for her presentation.
Thank you for your attention. My name is Gordana Vešligaj-Kos. I'm a physiotherapist, osteopath, and sensory integration therapist and teacher. I work as a neurodevelopmental therapist and also I'm the teacher in Croatian Academy of Osteopathy. Croatian Academy of Osteopathy is the member of Osteopathic European Academic Network, and we have a program of OSEM. Also, we have 4 years ago, and the combination of these two concepts was a real amazing for me. Sorry, excuse for my reading presentation, but my spoken English is not very good. Okay, first, what we can learn to after birth to facilitate further development is self-regulation. The environment we currently live in, along with the demands it imposes, place us under inappropriate stress and on various levels, potentially leading to the development of various disease and undesirable condition over a lifetime. This range from deviation on optimal sensory, motory, cognitive, and emotional development to chronic and malignant disease. Self-regulation allows us to lower our level of excitability when exposed to excessive stimuli, or conversely, to adjust the system to create its own stimuli when there is a lack, enabling it to function as a well-tuned instrument toward holistic health. Regulation is actually an intrinsic process and ideally don't require external support. Osteopathy is a form of manual therapy that engages in dialogue with the body tissue. This is keyword, dialogue with the body tissues. I think Tai Chi is also something that we must be connected for our mind and our body. If you only do some exercise, this is not Tai Chi, and also if you do any techniques in your work, you don't know what osteopathy is. Osteopaths believe that the body possesses natural self-healing, and their role is to support this process by removing blockages and promoting the proper flow of body fluids and energy. It is also known to reduce stress, improve mental clarity, and boost the immune system. Due to its broad impact on the body, osteopathy is an ideal therapeutic concept, which very few absolute contraindication. It's important for people who don't who suffered for some specific disease. due to its broad impact on the body, it's an ideal therapeutic concept who, based on premise, help bring the body in balance and let it heal itself. I think some principles have Tai Chi also. Tai Chi actually combined, how you know, all of us, combined elements of martial art, focused breathing, meditation, and body exercise. Controlled movement and breathing reduce stress and support natural process within the body. Oh, sorry. Okay. Techniques used in osteopathy include the muscle energy techniques, structural techniques, spring reaction techniques, cranial and visceral techniques, and as well as osteopathic biodynamics. Techniques used in Tai Chi, actually a slowly movement, controlled movement, focusing breathing, internal sense of balance and flexibility, and mindfulness. Where I am. Okay. Osteopathy and Tai Chi share goals like promoting the body self-regulation, improving circulation, supporting nervous system health, improving flexibility and balance, reducing stress and tension, and many others, but we have only 10 minutes. Both practice are based on the principles that the body has its own healing abilities, and osteopathy achieves this through manual techniques, while Tai Chi uses control movements and breathing to reduce stress and stimulate the body natural process. Circulation is circulation here not refers only blood and lymph flow, but also to cerebral spinal fluid, synovial fluid, vitreous, and interstitial fluid, all in body and all in our environment may be circulated. If we don't have a flow, we are dead, actually. Both osteopathy and Tai Chi stimulate circulation, which is essential for cellular health and detoxification. The nervous system plays a key role in coordinating movement and stress responses, and osteopathy works to reduce pressure on the nerves on physical level, while Tai Chi, through slow movements and focused breathing, helps calm and strengthen the whole nervous system. Flexibility and balance are essential for spinal health and injury prevention, and osteopathy through manipulation and mobilization helps the body achieve optimal mobility, while Tai Chi, with its control and mindful movements, fosters an internal sense of balance and flexibility. Stress and tension can lead to numerous health issues, and both osteopathy and Tai Chi offer natural way to reduce them. Osteopathic treatment relieves tension in muscle and joint, while Tai Chi helps to calm the mind and body. Osteopathy and Tai Chi in praxis, functional on the next way. The combination of osteopathy and Tai Chi is particularly beneficial for individuals suffering from chronic pain and or posture-related issues. For instance, osteopathic treatment can relieve muscle tension and improve mobility, while Tai Chi can help maintain these benefits through daily practice. For individuals with spinal issues, for example, osteopathy can help restore proper alignment of the vertebrae, while Tai Chi can strengthen the muscle supporting the spine and improve balance, reducing the risk of re-injury. First, people experience pain or tension in the body can start with osteopathic treatments to relieve initial discomfort and restore basic mobility. You know, if you have a pain or some restriction in your body, do some exercise is not your first idea. Once the body is free from tension, Tai Chi practice can help maintain flexibility and strength, and Tai Chi can be practiced daily. It requires no specific equipment or space, allowing the gradual improvement in mobility. Regular osteopathic session along with daily Tai Chi practice can help maintain health and reduce the risk of recurrent pain or tension. Breathing is key in both osteopathy. And Tai Chi. Proper breathing can enhance the effectiveness of both approaches by helping the body relax and open up. And the combination of osteopathy and Tai Chi should be tailored to the individual, considering the specific problem of end goals. Therapist and Tai Chi instructor can work together to design an optimal plan. Okay, and conclusion is these two complementary approaches to health and well-being based on principles of harmony and balance can significantly contribute to improving physical, mental, and emotional health. This synergy not only improves flexibility, reduces pain, and promotes overall physical and mental health, but also supports the body's natural strength for self-healing and self-regulation. Here we have some reference supporting information on osteopathy, Tai Chi, and their potential health benefits. And once again, please excuse me for reading my presentation, as my spoken English is not very good. Thank you for your attention. My translator is here.
Thank you, Gordana, for excellent presentation. Gordana was doing it in English, so all of you can understand. But yeah, if you have any questions, we'll do it after David's presentation, so you can ask all of us if you have any final questions.
Okay.
So, last, before we can go to dinner, or go eat. So, I was asked by Patrick to make a short presentation based on the presentation that I did in the national meeting in June last year. Well, some months ago actually. Based on the pressure that he put onto me just before doing this introduction, I added some extra slides because it's not only about beer and chocolate, but it's also about meat, and you will see why. So it gave me a little bit more pressure, but anyhow you will see it. That's why I added some extra slides during the coffee break. Anyhow, the presentation today, so my name first, I'm David Becquet. I'm a professor at 2 universities in Belgium. I'm mostly affiliated to the Vrijuniversiteit in Brussels, as well as the Leuven Research Group in the University of Antwerp. And this is the group that I'm honored to be leading. This is a rehabilitation research group, and we do research on movement and rehabilitation in the context of oncology, neurology, but also, which is actually my main field of expertise, healthy aging. And so that's also the talk that I wanted to do today. How could we put Tai Chi in the context of healthy aging. And to make sure that we can do that, I will introduce first the vision of WHO, the World Health Organization, on healthy aging. Next, I will talk about how exercise and what the scientific foundation is for exercise to support healthy aging. And then we can go then to the last part, which is actually the reason why we are here, why you worked in the last two Wushu Elixir projects, Tai Chi for healthy aging, and what does the science says about it. So first, WHO's vision. This is actually a big report from 2015 that WHO presented on how they see people living older in a healthy way. Yeah. And for that, they actually put two definitions for very important constructs, the blue and the red words. It's about functioning in daily life and about the intrinsic capacity of a person. And this is very important constructs that you will see in the next slides, and where I will try to link exercise and Tai Chi as well. Functional ability, as defined by WHO, is actually about living and being functional in the environment. All of us need to be functional if we want to do what we would like to do in life. And it can differ, and it's very dependent on the environment. For example, this person, although she has the same limitations in health or in function, this is much more difficult to be functional in a very remote area compared to a more city environment. Yeah? So there's a clear link between being functional and the environment. And also the intrinsic capacity, which is the other important construct. This is about how we as a person have the capacity to be functional in daily life. Yes? And intrinsic capacity is actually this square. It's about genetics. It's about health. It's about being able to do what you want to make sure that you are functional in daily life. Think of, I need to have enough muscle strength to go up the stairs and go down the stairs. But I also need to have enough endurance to make sure that I can walk towards my bus, that I'm not feeling too tired. I need to have the cognition. I need to be able to think enough before I need to do a calculation in a shop, for example. I need to have the mental well-being as well. I need to have the capacity to see if I want to be functional. I need to have the capacity to hear if I need to be functional. So intrinsic capacity is summarized in these 6 domains. As I mentioned before, I need to see, I need to hear, I need to be able to think correctly, I need to be able to move, I need to be able to have good mental well-being. And this is a very recently defined, only recently in the Lancet it has been defined, vitality. It's actually about feeling to be energetic, to have less fatigue. Yeah? And I heard a lot of the people that were talking in the film. They felt more energy, they were less fatigued. So it's a very important potential outcome measure in future research as well. So how does healthy aging look at these 2 constructs? During life, with increasing age, you will start with high muscle strength, high endurance, but due to molecular damage, due to diseases, over time, this is a natural process, it will decline. You feel less strong than 20 years ago. Because of that, also the functional ability decreases over time a little bit. And hopefully not too far, but maybe you can feel it. You are not that going at ease up a stair than 20 years ago. So being functional decreases a little bit. This is not, I didn't invent this, this is the WHO. Up until a way you are functioning in the society, hopefully you will not reach that threshold. This is an artificially threshold. But if you are above this threshold, your functional abilities are enough to live independently. And actually, this is a very important outcome for a person. If you ask older people, how would you like to live and what is the quality of life? As long as I can stay at home, as long as I'm independent, that's actually my main goal, where I would like to be motivated to do exercises or Tai Chi or anyhow. This line of intrinsic capacity, as I told you, actually, it's a line that comprises several dimensions. Yeah. But this line is actually a population line. That means, if you consider all people over the world, the mean, the average of these people, this is how it will show. Yes? But actually, so this is the same line, but actually some people are very better. They have actually better with aging. I think Patrick showed it before. He's 62 now.
64.
64. I would say Patrick is maybe higher than the norm, yeah. But some people, even at my age, 46, so we are just they are very low in their intrinsic capacity already at that time point, yeah. And maybe some, due to a stroke, due to cancer, they will decrease in their intrinsic capacities at a certain age. And due to rehabilitation, which is actually my field, I'm a trained physiotherapist, we can hopefully improve a little bit this intrinsic capacity. Yeah. So this is all WHO that has his vision on the healthy older adults. And one more thing, maybe you have already heard about the concept of frailty. Frail people, those are actually people that are living here. They do not have any problem yet to be functioning in the society, but it's actually a predisposing situation. You can actually say, I look in a glass ball and I know if you are frail, you can measure this. If you are frail at this time point, we know within 3 months up until within 10 years, there will be deficits, there will be problems. Yeah? And now we come to the place where exercise comes into play. Because we know, if you can identify these people, we can, with easy measurements, there's only one important way to bring this trajectory back to, hopefully, the normal way. There are no pills, no medication. The only way to do it, scientifically proven, is exercise. That's what I wanted to stipulate here. But first, this is why I didn't have my caffeine today. Actually, this is a Flemish title because I didn't have the time to translate it. But what you see here is actually all kinds of studies that investigated the number of hours that older people are sedentary. They do not move during the day, except from sleeping. So they wake and you go back to sleep. Yeah, you wake at 7 and you go back at 10 o'clock in the evening to sleep. On average, 9.4 hours they are sitting. They do not move. They don't do anything. And it's about a lot of people. You can see for each study the number of patients that were included to calculate this hour. So a lot of the hours, a lot of the people are sedentary. They do not move. Yeah? It's only 3 slides that I added for Patrick. These are exercises that looked in what is the effect if you don't do anything, if you just be sedentary. Yeah? These are actually very strange studies. Each of these studies, they asked people to get in bed, to not go out of bed for 10 days. They get money for it. You want?
Yes. Thank you. Yes.
I have a list. You can add your name. But wait for the next slide, and then we will say.
No problem.
Just as an example, I take this study, already 10 years or 11 years ago, where they put people 10 days in bed, and they measured the percentage of muscle loss per day, as well as the percentage of strength loss per day. Yeah? So you can see here, 0.5% of the muscles that they have per day are lost, just by laying in bed. Yeah. I want to make it concrete. That's my statement. Remember the meat?
Was the meat?
This is actually a very difficult graph, but it's easy actually. You can see the age of people, and you can see the muscle mass in kilograms, so the amount of muscle one person has. Yeah? And if we take a 65-year-old person, a male, you can see apparently that there is about 35 kilograms or even 32 kilograms of muscle mass. If you're 65 on average, you have 32 kilograms of muscle mass of steak. Yeah. If we consider 0.5% per day of muscle mass loss, that means that on one day laying in your bed, you lose 150 grams of muscle mass, which is steak. This study did it for 10 days. So that means 10 steaks after 10 days. So that's actually why we as physiotherapists, that's actually why I say to my students, after a surgery, immediately out of bed, directly, even if they do not want, because this is the result otherwise. Yeah. So that's the steak story that I just did. So, do you still want your name on the list?
Yeah.
I like barbecue, so it's okay.
I have 102 kilos, so
Okay.
I need 30 days.
Okay, so the question in the context of healthy aging and frailty is not, should we exercise or not? That's not the question. Because indeed, physical activity is the only one proven intervention to counter frailty. Yeah? If you combine physical activity and protein or nutritional supplementation, you even do not see a significant effect. And mainly because of the dose response, because probably there is too few physical activity compared to if you only do physical activity or if you combine it with nutrition. Yeah? But other trainings like social pharmacotherapy, maybe one just suggestion for you. If you hear in the news that pharmacology or pharma industry has found a pill to counter frailty, instead of exercise, just go to the bank and buy the shares because it will boom. But for now, the only way to counter frailty in a healthy aging context is physical activity, is movement. Yeah? So it's not about to exercise or not, it's actually how to exercise. Because you can move, you can do exercises like squatting, or you can sit and do a straight leg raise. It's actually comparing pears with apples. And that shows in science. Because, for example, this is a meta-analysis. These are studies that each of them separately investigated the effect of an exercise program on frailty, which I showed you before, the glass ball. There was no effect. They did not see any effect after 12 weeks, after 3 weeks of training. However, these are the studies that investigated it for 24 weeks so far. They did show an effect. Yeah. So exercise is great, but you need to exercise properly. So you need to consider the correct modalities of the training. Yeah? And for here, it's about duration, for example. But there are other training parameters that need to be considered. This is called therapeutic validity. Do we consider the correct modalities, knowing from what we know from studies? And this is actually translated into clinical guidelines. We have clinical guidelines in 21 presented, international exercise recommendations for older adults, specifically focusing on the specific modalities of a training. If you want to train balance, well, you should at least consider this frequency, this volume, this intensity. If you want to train and achieve effects in resistance training or in aerobic training, you need to consider at least this. And this is not just invented, this is scientifically supported, as well as considered by a lot of exercise specialists in older people. For example, if you want to do resistance training, you want to gain muscle mass, 70 and 80% of 1 RM, that means 80% of the maximum weight that you can lift. You take 80% of it. That's the way how you need to train strength training as an older person, not as a young person. There is no reason at all to decrease because it's an old person. Maybe we should consider it to be lower. Also, what they suggest is to use a multi-component. So not only focusing on one of these, but on as much as possible. So including both resistance training, aerobic training, and balance training. And I hear a lot of you specialists in Tai Chi thinking, actually what we do is the combination of these, all of these. We do and both resistance training, but we feel it in the legs if we go down. We do aerobic training because at the end, we really are sometimes exhausted because of the movement that we do. We do balance training because some one leg stances are really challenging for the balance. Yeah? Maybe what we did not do yet is to consider the science behind the exercise program, except from the Tai Chi programs. But that's the thing that I give you. And another thing that is really a challenge, and that's with all lifestyle changes, that's treatment adherence. Do we adhere and do we continue adhering to what we should do? A lot of you will see people coming into your club, and after some weeks they are very motivated, but after some months some of them will drop out. And how could we change that mindset, which is actually behavioral science, to keep them in the program and to keep them motivated to continue? And that leaves us finally to the last part, the Tai Chi part. Yeah. So the question here is, again, should we Tai Chi, yes or no? Well, that's not the question. Because a lot of studies, again, highest level of evidence, show that Tai Chi programs are beneficial for a lot of health-related issues. Yes? So it has proven beneficial effects. For example, meta-analysis that shows actually there's the highest level of evidence. That means that a lot of studies have done it to assess the effectiveness of Tai Chi, in this case, on quality of life and depressive symptoms. It has favorable effects. Remember one of the bullets that is part of this healthy aging of WHO. Another one, specifically in frailty, remember the glass ball. In these persons, we know that it can improve physical performance, mini-mental state examination, that's cognition, it's about thinking, cognition, and depression and quality of life, part of the psychological capacity. So we know that it works. That's been proven also by the both projects of Wushu Elixir as well. But maybe we could think of, should we think of the way we apply Tai Chi, specifically focusing on the specific target population? Because I heard people talking about osteoarthritis. Well, people with osteoarthritis have different needs and rehabilitation outcomes than people with cognitive problems or mental well-being problems. And because of the different needs, from a rehabilitation perspective, we have different interventional approaches, as you could see in the table before. And I want to show you that it is indeed how to do these Tai Chi programs. There is already some beneficial effects, and suggesting that we should consider this approach of the Tai Chi, the new Tai Chi program. Because what you see here is, again, a lot of studies. Each of these studies, separately, starting in 2006, but also one in 2015, and they investigated the effect of Tai Chi compared to non-Tai Chi on fall risks. And what they see, overall, if you put it all together, this number means actually that Tai Chi decreases the risk of being a faller with 24%, which is great. They do some sub-analysis, which is called, and I don't mind the statistics, but what they do is actually, if you look at those studies that apply one training per week, and you compare them with those that apply it twice a week or thrice a week, then we can see improvements. Because compared to one time a week, if you train 3 times a week, you can even increase the risk of being a faller with 33%. And that's actually what one of the, I think, Flemish people was saying, because he said, normally I do it 1 time a week, but now with the program I do it 2 or 3 times a week, and I feel more improvement. So this is actually supporting what he's saying. Yeah. And these people, it's only a meta-analysis of last year, they suggest to consider these findings to design the new Tai Chi interventions for fall prevention. This is suggested by this Chinese group. It's not all about fall prevention. They also look at balance, and for balance there is a test which is called timed up and go. That means you sit down on a chair, you raise, you go 3 meters, you go around, you go back, and you sit. So you measure a little bit strength, but also balance and mobility. Yeah? And you measure the time to do it, and the shorter the time, the better performance. Yeah? And here as well, you can see significantly, so on the p-value, as we saw before, you can increase that time with almost 1 second. You can ask, is this really relevant? 1 second? It's not that far. Anyhow, they saw that if you consider the duration, the more you train, if you consider the frequency, the more frequent per week you train, And also the style in this case, apparently Yang style compared to Sun style was better. Yeah. If you consider these, then you could improve also here the results. Yes. And especially duration and frequency has to do with motivation. How can you keep your patients motivated to be in the program? And then I come to one of the final slides of my presentation, final take home. I used the same ChatGPT instruction as the previous presenter. Maybe we can learn, that's what actually because that was actually the goal of today, at least that was asked to me from the presentation. Could we learn from the conventional exercise science regarding insights on to improve the beneficial effects? We know that it works, but can we improve it even better? Maybe we could consider in these Tai Chi programs, in line with what these specific use cases, patients, populations need, what we call therapeutic validity, considering what we already know from exercise programs, the boring analytic exercise programs. Okay. So making it more challenging from a very easy balance approach, which can be considered very difficult for person 1, but too easy for person 2, and for that person 2, there will no beneficial effect for balance and for risk prevention. But if you could consider this part, well, I do not know that this is really an official stance concerning to ChatGPT this, but I didn't see any one of you doing it if in front, maybe.
The David stance.
Yes, David stance. Yeah, we are 2 Davids here apparently. No, but what I mean is, you could consider to improve it so that you can challenge this intrinsic capacity, the balance part at least, the balance part of the program. Another way of looking at the research gaps is actually looking to these motivational aspects. And I think this is something that we can see in different domains within aging, also from a social perspective, that is doing intergenerational programs. And I was really happy to hear during the talk that there is really a lot of potential in it. But first, this part. If we want to make it challenging, there is now, well, last year I had the opportunity to chair a workshop on the World Physiotherapy Congress. And Mel Farley is a colleague, a good colleague, and she developed actually the Balanced Exercise Intensity Scale. That's actually a scale to measure how difficult it is for a person to remain balanced during an exercise, considering that some exercises might not be challenging enough to reach the goal for that specific person. So individualizing the exercise programs. It could also be a concept to consider in the Tai Chi programs as well, if you will use it for health enhancing goals. And the other one is what I heard from David.